October is Breast Cancer Awareness Month. Well, let's discuss it. Hi, I'm Dr. Jeremy Briner, bariatric and foregut surgeon, and I specialize in both medical and surgical obesity management. In part 1, we discussed the risk factors for breast cancer, and in part 2, we discussed how early detection saves lives. Today, I want to talk about the tangible ways you can reduce your risk for breast cancer, and briefly touch on the treatment options if you have been diagnosed. Let's first talk about the non-modifiable risk factors, the things you can't really change. These are things like age, gender, family history, or genetic mutation. And although you can't change these things, you can empower yourself by knowing what they are and if you are at risk for them. Being informed helps you have better conversations with your provider and come up with strategies for earlier detection. But in this video, I want to focus on the modifiable risk factors. Let's start with alcohol consumption. Alcohol increases your risk for breast cancer, and the recommendation is to not drink any. If you do choose to drink alcohol, it is highly recommended to limit it to less than 3 drinks per week. Now let's talk about diet. Diets that are higher in fruits, vegetables, soy, dietary fiber lower breast cancer risk, while diets high in red or processed meats, high glycemic index foods, and added sugars increase your risk for breast cancer. We can't talk about diet without talking about physical activity. A sedentary lifestyle increases the risk of breast cancer. Try to increase your exercise and your non-exercise activity. For exercise, aim for a goal of 150 to 300 minutes of moderate activity or 75 minutes to 150 minutes of vigorous activity a week. There are several ways to increase your non-exercise activity. These are things like taking the stairs instead of the elevator, parking further away, doing regular activity at home like gardening or cleaning. All of what we've talked about so far leads us to the disease of obesity. Having the disease of obesity increases your risk for breast cancer. This is especially true for postmenopausal women. For every 5-point increase in BMI, your risk of breast cancer increases by 10 to 12%. Intentional and significant weight loss, whether it's achieved through lifestyle modifications, pharmacotherapy, or bariatric surgery, greatly reduces the chance of breast cancer in patients with obesity. With the strongest and most consistent evidence for bariatric surgery, as this is our most powerful tool for safe and effective lifelong weight loss. So now let's touch on what if you've already been diagnosed with breast cancer. Well, there are several treatment options, and these are determined by things like disease stage or molecular subtype. It's a nuanced discussion that you should have with your provider, but know we've come a long way with our treatment options for breast cancer. And there is hope. We all know someone who's been diagnosed with breast cancer, and breast cancer is relevant in all fields of medicine. And that's why, like I said, when I talk to my patients about options for weight loss, the number on the scale is arguably the least important part of the discussion. For me, it's the benefits, like reducing a patient's chance for breast cancer, that make me so passionate about what I do. My goal is to help make happy and healthy happen. So I encourage you to keep raising awareness for breast cancer. If you have any questions about bariatric surgery or obesity medications, leave them below and I'll be happy